Um, Somebody has dropped. Okay. Okay. Joined again. Okay, Kalaivani. Got it. Okay. So Gopinath, Akshaya, Pravina. Pooja. So four of you will be talking for against the topic. Um, Whereas Roshni, Sri Bhuvaneshwari, Sukanti, and no, Pravina Sonanalia. Sorry, I missed.
Yes, sir. You said.
Okay, perfect. Then Kalaivani, right? So Kalaivani, Sri Bhuvaneshwari, Roshni, and Sukanti. You are going to talk for the topic. Okay. So the topic is, I don't know how many of you have heard about this one. It's a interesting topic, and they gave me once when I was participating in a debate back like 20 years ago. நான் chatல போட்டிருக்கேன். So euthanasia, that's the topic. Have you ever heard about this topic before?
No, sir.
Okay. So euthanasia is nothing but mercy killing. So mercy killing means there are cases where they will have to kill a person because they are already dying and they are already suffering a lot. So you have to just research about this topic and talk for and against. So I'll give you a little bit extra time today for preparation. So it's 10:07. So 8:37 now. So we'll start at 8:45. Okay. So you will get 7 minutes today to prepare. 8 minutes today to prepare. Any questions? Okay. I assume that there are no questions. We'll start at 8:45.
Shall we start, sir?
Yeah, go ahead.
Okay. Good evening, everyone. I'm Pravina. Today, we are all gathered here for group discussion. The topic is about euthanasia, mercy killing. So, my point is, life is more valuable and precious to the human beings. So, no one had no one had rise to destroy the life of human being, and so the enthusiasm mercy killing is about.
Praveen, I'm not sure whether it is just for me, but your voice is breaking up, so I'm unable to hear.
Hi everyone. Today topic is about mercy killing called as euthanasia. Euthanasia is a very controversial topic for me because see most of the time the doctor cannot correctly predict what disease we have. Sometimes there will be a wrong diagnosis. In that case, see for example, let us consider a disease as H. This disease slowly causes you that the suffering is so heavy. So your family members are like to do euthanasia for you. But after some days, it is it find that the disease is not that much harmful to you. So see here, what goes wrong is when a people is suffering from disease or something, we need to treat them. We should not harm them. That is my point here. Um, you can add a point against this, or you can support me.
I
Uh,
want to tell it is not a suffering, it is a relief from the pain. Euthanasia doesn't give them pain. It is a pain relief process. Within 2 minutes, the deceased person will die without any pain.
Yeah, Sugandhi, that is correct. But life is precious, right? Ending someone's life is not proper. I think that even if they are sick, it goes against like a belief, against their belief of life. They might feel like the life is not sacred, like,
It
and
is
it may
also in
also.
their hands also, and it is not about sick. It is about unrecoverable diseases. That's why this process is taken. For normal diseases, it is not usually taken. Unrecoverable lifelong diseases only euthanasia takes.
Suganti, I have a point here. I have spoken earlier that what you will do if a doctor wrongly diagnoses a disease. So he gives a solution. Let's do euthanasia for the patient. So, what is your point on that, Suganti?
It is not doctor's choice. First of all, you understand that it is not at all doctor's choice. It is the patient's family members, their choice only. A doctor can't force them to do that. Okay.
Suganti, let us take that as an advice or some other suggestion. Okay, let it be not given by doctor. Let it be given by their relation. Let it be given by their family members. What my point is, if the disease is diagnosed wrongly, after some days or some year or in some decade, it is found that it can be curable. Or sometime the disease what they have diagnosed is not that what he have actually has. So at that time, at that point of time, euthanasia is a wrong decision. No. So what you are going to do if you do euthanasia for that patient, the patient has lost his life, but later it is turned that the disease can be curable or something. The euthanasia, where the euthanasia is not a solution. So my point is that on that time, whether the euthanasia is good for that patient.
Yeah, Gopinath, what you're trying to say is, I don't think doctors will let the disease go and takes that position. Like it will lead to euthanasia. I don't think, because the in between the process, if there is something like that, it can be found. So if the disease is really uncurable, I think it's better, because it would take a lot of resources. Practically speaking, uh, anyone can be took care for 2 to 3 years. Everyone have their own life, so I think it will be emotional relief to family members too.
No,
That's
Puna.
my point.
And
Yeah,
also,
Bhunesh.
Yeah, I'll
we
accept
we we are not
your
going
point.
to consult
But
only one doctor. We are going to consult 2 3 doctors. After consulting two or more doctors, if they are saying same, then only euthanasia will be done.
so I'll accept
Uh,
all points. But the euthanasia is recoverable. The euthanasia will be a severe disease for the human beings, but the person have their own confidence will get soon recovery. So that time and then the euthanasia will not the euthanasia will not done for the person.
And
I
I
like
would like to make.
also, yeah, Roshni, you can tell.
Okay, as you said earlier that euthanasia is really useful for the who were stating in the last point of breath. I accept the point, but there is a case called Aruna Shambhag. She was a nurse who worked in a KEM hospital that's in Mumbai. She was brutally assassinated in 1973. Okay, but still now she was her parents was asked for euthanasia, but they didn't. The court doesn't provide them. So she was finally got the judgment on 2024. Totally 42 years she was suffered in that case. So what would you like to say?
Euthanasia is a legal and safe option. It is also a valid point.
But why the court judgment didn't approve her euthanasia? Her parents itself, it wasn't a passive euthanasia. Her parents asked them. So why didn't the court provide them? Because there is a reason. Each and every euthanasia time period level have a valid point. Euthanasia cannot be decided by any other person, whether related relatives or parents or guardian, anybody. Only she can decide whether she want to make her endpoint.
I like to add a point here. Most of you have listened to that a very famous TED talk by Sparsha. He is when he born, he had almost 35 fractures. So then, on that time, everyone had their relatives or their parents, all of them asked to what that euthanasia, but their parents doesn't do that. So soon after, when he was, I think around 15 years, he has become a very popular singer. He have remixed the famous Eminem song called "Never Give Away," like that song. So when Roshni had said that only the person who have affected by the disease has a decision to make the euthanasia call. See, the baby, the just now born baby, I think the baby doesn't have that knowledge to take whether we need to have a euthanasia or not. On that case, what your point, Roshini? See, uh, sometimes the taking euthanasia for children's and many engaged children got affected by many diseases, but they don't have the knowledge of taking euthanasia, or some their parents only going to decide that, are there some other courts or some other judgments. But what my point is, day by day or time by time, everything will be changed. Yeah, I know there will be a struggling on that path, but the sculpture is scripted only by making a hard damages on the rock. That's what I'm believing.
Yeah,
I
and
really
I would
accept
like to add some.
that.
Okay, yeah, go. And I would like to add some points from Gopinath. Like you are right. Sometimes euthanasia is good, but like a greedy relatives or unethical healthcare providers might misuse that for their gain and for healthcare reduce their healthcare cost. It not always in right ways, right? It also be um, it mostly it cause some corruptions like for healthcare providers.
And now for your question in the Spasha's case, I really accept the point. It was a newborn child. He or she might not know about her health condition, but he or she was born to live. Let if she has a good time, she may alive. If we kill in the birth, she won't be. I think it is not good because if she might grown, she had a good medical health care. She also can make some achievements, right? By killing on the birth is, I think it's not a correct decision. It was a child. He or she was born to live.
Yes, Roshni, that's what I'm saying. The child should live unless we shouldn't give euthanasia to them. Uh, what's her name?
Sorry, Anna, I couldn't
Last 1 minute,
understand what
guys.
you are saying.
Pooja, will you please add a point how euthanasia will harmful for the societies?
Yeah, Gopika, I have one point. First of all, ending someone's life is not in our hand. And my point is, instead of taking Hindustans, we can focus on um, more medicine for taking care, reduce pain. So this will help they to cure. Uh, I think, and I think with with the proper love and affection from the family will make him um, pure instead of taking in the statues.
That's a wonderful point from Pooja. Love and affection straight to cure the patient. And what I like to lastly add here is euthanasia is not a permanent solution to any disease or any harmful suffering you are facing. What my point is, sufferings are just passing clouds. It may take some time to handle the sufferings, but you should wait for the right time. For example, I have said no, Spasha, a motivating person. See, if the baby has born, and the disease he has facing is so severe, let them allow to have at least 5 years because in between the 5 years the technology may grow, lots of improvements may be happen within that baby. So euthanasia should not be a final call for anything. That's what I'm believing. Thank you.
So
Cool,
I would
guys.
like to add a last point. So life is more valuable and precious. So no one had rights to destroy the life of when there is a even there is a disease is more insights, but Ravinaka, are you there?
You are on mute.
Yeah, looks like Pravina has some issues, so that's fine. Anyways, I mean, we are already
To make a point.
Okay, it's already 10:30. Okay, Roshni, finish it up.
I too want to
Okay,
add.
Gopinath, and sorry, I understood your point wrongly that a child was born to live. I accept the point, but in few cases we have to accept the reality. If the child was born with the same diseases, she may or he may suffer a lot. So for that, the government of the Supreme Court of India was announced a news on January 25th on 2023 that Supreme Court was asked to produce on passive euthanasia, sorry, passive euthanasia. So each and every individual human has their rights to make their end of call. So the child, I accept that the child don't know about the point, so that the parents or the treatment makers or like doctors can make an approval. If the child is really going to suffer a lot, then euthanasia is a correct decision. If there is a chance to live, then euthanasia is not a point. Thanks.
That's what our
Yeah, so
point also. Yes, sir. You can.
yeah, I think Sugandhi had one point. We'll wrap it up from her, and it's already 1 minute past. Yeah, Sugandhi, go ahead.
First, euthanasia. Eu means good. Thanatos means death. It means good death. That's what I want to tell, sir.
Nice. Cool. It's a great conversation, guys. So I see someone named Kamalini, but didn't speak up. Kamalini, I mean, are you new to this group, or is somebody else joining in this name?
Yes, this is my first meet.
Okay. Do you like to add any points towards this topic, either for or against?
Actually, I joined late, 45 minutes because I have attendance in my hostel.
Okay, that's fine. So going forward, yeah, I mean, if you have conflicts, just work with Harini and see how we can decide a nice time. Okay, that's fine. Thank you for
Sure.
joining. Okay, cool. Sorry, guys. I mean, it's already 3 minutes past. I will try to wrap it up as soon as possible. Please stay there for 3 or 4 more minutes, right? First of all, I mean, I would really like to appreciate every one of you who has taken some time in researching on this topic and present it. See, this is a real challenge, right? Because this topic is new to you, and that's why I gave you the explanation or meaning of the topic. When I was when I was given this topic, they didn't even give me the meaning of it, and I was in fact writing it as youth in Asia instead of euthanasia because I didn't know what euthanasia stands for. And I was preparing from based on my understanding, but only thing that I did well was I didn't start the conversation. Somebody else started, then I understood, okay, the topic is completely different. And then but it was a nice learning for me. That's why I always give this topic in every session that we conduct. So first of all, I would like to appreciate Pravina for starting it, right? Sorry, I got another call. Am I audible?
Yes, sir.
Yes, sir.
Yeah, okay. So Pravina, it's really good that, I mean, good to see you have started the conversation, right? And you are what looking at the time, which is really nice, right? That's why I gave the time today and wanted to see whether any one of you note that, and I'm so happy that Pravina was able to speak, and kudos to you. But of course, Pravina, looks like you had some connectivity issues. Maybe I understand the challenges related to that, but from next time onwards, try to see whether you can get to a class situation where get to a place where you have a good connectivity, right? Because I don't want you to lose because of that.
Sure.
Okay. Then Sukandi, I'm so happy to see your progress, right? And you had a lot of points, and the way how you were trying to answer every questions or every points that was given by the opponents, it was really nice. And even at the last minute, you wanted to share your thoughts about the explanation or the expansion of euthanasia, which is nice, right? Good to see your progress. So happy. And I'll come to Gopinath at the end. I have spoke a lot about him. Sorry, Gopinath. And for that matter, Sri Roshni as well. So we'll go to Sri Bhuvaneshwari. Yeah, I think initially you didn't speak, but after some time you got very great points, right, to start your conversation. And the one that stood out for me was the point that you made about the emotional relief to the family members. That's a great perspective and a nice way to put your thoughts. Nice. I mean, keep up the good work, Sri Bhuvaneshwari.
Thank you, sir.
And then coming to Akshya, yeah, same thing. I think you had some hesitation initially, but there was a point where you were trying to put forth your points, and then from then on you had whenever you got an opportunity, you were adding very good points. And the one that stood out for me was when you spoke about the healthcare. Healthcare can be or the healthcare can be the healthcare professional can be using this for their gain. That's absolutely correct, and that was a very good point, because commercialization, right, where people only worry about money and not about the life, right? So yeah, that's a valid point, and good work. And yeah, Pooja, I know this is your second session per se, but again, uh, thanks to Gopinath, because he found it, and he asked you to speak, and then you were able to open them. See, these are small things that changes the dimension of the entire speech, right? So from Pooja's perspective, she was a bit hesitant. She had some points to say, but this is her first time speaking, and so she was waiting. And when Gopinath asked her to speak, that actually gave her some motivation, right? And that's why she was able to start speaking. So this is what is called as a teamwork, or it's really nice to see that happening. And at the time, Pooja, I mean, good that you spoke up, right, instead of hesitating, right, which is nice. And when you spoke up, it was like one point, but it was very good point, where love and affection that can cure. I mean, yeah, see, again, I have already repeated this multiple times. Again, so Pooja, don't worry. Nobody is going to judge you on how you are speaking. The forum is mainly to help folks to get rid of the fear. And we have a lot of people here who were hesitant in the first two sessions, and then now you can see how they are really competing with each other. So I'm expecting you to speak more, take more opportunities to speak, right, going forward.
Sure, sir.
And and coming to I'll first talk about Roshni. I really like the way how you are doing your research, Roshni, and especially you are the standout performer in one aspect, where who spoke about a factual case, Aruna's case. It's a very good point, right? And because that makes people really think and understand, oh yeah, this is the real problem. So that's kudos to you for bringing that. And also one more thing, more than that, the one that I liked was your team spirit. There was an instance where I think Akshaya and both of you were speaking at the same time, and then you did what you did is you paused, and then you asked Akshaya to speak, and then you spoke. I mean, See, as a moderator, these are the things anyone will look for, and I don't know how many of the others noticed that, but see, that's the team spirit, and that's the thing that every individual should have. As I already told, right? It's not about just being the speaker; it's about being the listener as well and letting others speak. And very good thing that you did from that perspective. Keep up the good work. And finally, Gopinath, yes, I mean, as usual, the way how you, I mean, nothing to talk about your points, right? You always have valid points, and it was very nice the way how you were explaining, right? And especially answering the questions from the other opponent team, and especially I think there was one instance where I wasn't sure it was Pravina, Suganti, or Akshay, I don't know who it was. There was an argument about doctors. It was really nice to see that kind of arguments, right? Both of you had valid points, and the way how it went, it was really nice. And point out thing was, I mean, the TikTok example that you gave about the Eminem song. Yeah, I mean, those are small things that attracts even the listeners, and it is very good. And of course, as I already mentioned, asking Pooja to speak up, yeah, that shows the leadership quality. And keep doing it, keep up the good work, guys. See, I initially wanted to point everyone's mistakes, okay, but the way how the conversation progressed, I really liked the way how you are progressing, right? Because it was not like beating around the bush, because this is one of those challenging topics which has the emotional bonding to it. So if you really hit the tone right, you can, I mean, these kind of topics will help you really learn a lot of things from others, and also helps you with a contextual speech. But I mean, overall, I'm super impressed with the way how this session progressed, right? What I personally feel is that, I mean, somehow I think this is the second time I'm feeling that everyone are so eager and so happy about speaking, right? And 15 minutes wasn't enough. We had to extend, so which means the topic's really nice and it's interesting. So we'll continue on the same topic next week, okay? But with a small change. Whomever spoke for, they should speak against the topic. So you got it right. So that's the thing that we are going to do for next week. And see, the reason why I am insisting on this is you have time, 1 week of time to prepare and research about the topic, and we'll see after, because we have been doing impromptu debates till now. So this is the first we are revamping the first time, where we are going to give you some time on the topic, and then we'll see how we are progressing. And again, I'm telling you guys, next week I'm going to be focusing more on the negative aspects of, when I say negative aspects, the areas of improvements of how we can improve. Okay, cool. And sorry, I took close to 10 minutes, but any questions before winding up today?
Sir, I need to. Will you please point out my mistakes in that conversation, sir? I have made lots of mistakes, I think. If you
No.
point out
I
some
mean,
mistake.
no. See,
Ah,
of course, there were grammatical mistakes, right? But again, I didn't even. I was planning to note it, but the points that you were explaining was really so nice that I even it even diverted me. So don't worry much about it. But yeah, I think there were some grammatical mistakes. Yeah, if I remember correctly, I think you said spoked or something. Yeah, basically speak, spoke, spoken. That's the those are the three words, right? So there is no word called spoked. So
yes, yes.
yeah, so that's, again, you will easily get rid of this when you practice well, right? So, but other than that, I mean, everything was good, Gopinath. So nothing to worry.
Okay.
But try to, as I mentioned, right? All of you try to focus on the grammatical part as well, because I'm going to give feedback on that as well. Okay. Cool.
Sure.
Any,
I would like to
any
thank.
other question?
I would like
Yeah,
to
yeah,
thank
Pravina.
yourself, sir, for giving this such a wonderful topic for us, for learning us.
Good. Thank you. Thank you.
I would like to say thanks for Gopinath for giving me the chance to speak.
Nice, nice.
So nice.
Cool. Nice, guys. See, that's all right. I mean, see how the team is gelling now, and I can really see the interest people are showing and waiting for this weekend's session. Right. I mean, it's really nice. Good, guys. Great progress. Keep continuing with the same progress. Okay. Cool then. Have a nice week ahead. We'll talk to you next week.
Thank you so much.
Yeah. Thank you. Bye bye.
Thank you, sir.
Thank you.